Welcome to Stand Up for Doctors. I'm your host, Kim Downey. Thank you very much for joining us. I'd like to welcome Dr. Brittany Busse. Thanks for joining us today, Brittany.
Hi, thanks, Kim, for having me.
I'm really happy to. And by way of introduction, Brittany is co-founder of ViTel Health, a champion for independent physician practices and equitable care, and a lifestyle medicine and food as medicine patient advocate. And today we'll be talking about how you've had significantly difficult experiences in medicine, which unfortunately is not unusual, yet you're working very hard to drive positive change. And also what you're doing to support physicians and what you want physicians to know. And to get started, what would you most like our audience to know about you as we begin our conversation?
I don't know. That's a broad topic. I think that the most important thing to know about me is that I have definitely gone through challenges in my life, but it's really important to me to take a broader perspective on everything. And, everyone always says that hindsight is 2020, right? Like, and when you're in the middle of something, like I absolutely would not advocate for anyone bypassing their emotions or the difficulties, but to really understand that there are people who have been where you are, and I'm, always sharing my story for that reason, so that people know that they're not alone in these experiences, that there are other people who have gone before them that they can reach out to, and that things can always get better than where you are right now.
Yeah, no, that's terrific. And what that brings to mind, so for our recording, initially we were going to be with Dr. Kristen Yates, and unfortunately she wasn't able to reschedule her patients. And then Dr. Todd Gedman was supposed to come on, but then he had some last minute issues, and I even asked another physician, and he had a meeting. And when things used to happen, I would be really disappointed. But my physician coach, Dr. Michael Hirsch, had said when we had started coaching, he says, what happened, whatever happened was supposed to happen because that's what happened. And at
Mhm.
first I was like, what? And I wasn't so sure how I felt about that. But now I have to say it helps me accept things a lot more quickly. And I'm like, okay, well, it was just supposed to be you and me, which is fine
Yeah.
and great. And my first 30 episodes were just, one-on-one. So I was wondering, what do you feel about that?
Oh yeah, I'm in the middle of reading the book Wherever You Go There You Are by Dr. John by I don't know if he's a doctor, maybe it's John Kabat-Zinn. So I love mindfulness. I am a practicing meditator for many years. I'm actually trained in a form of transcendental meditation called integrated meditation. So they kind of take a more holistic view. That's super important to me because it's just that, like, wherever you are, whatever you're experiencing is exactly what you're experiencing. It can't be any different because it is what it is. And you have these three choices, right? Like you can accept it,
Mhm.
you can change it, or you could run away from it. But those are kind of the only three things that you can do in that moment. But being fully present in it is what allows you to make that decision, right? Because, so often we can really react to a negative experience. We go back into our default operating system and our default mode network, and we're just going to go back to what we always do. And that may or may not be helpful for us when those things were built when we were children, right? And so we're really operating from this like very childlike place. It might negatively impact our relationships and even, mostly ourselves. I think, especially when I'm talking to doctors, is that they make these very like snap decisions and they end up negatively affecting themselves more than other people. And so when we learn to really accept what's going on with us and feel the feelings, feel what's happening, evaluate our thoughts around what's happening, then we can come into the response, right? And we can make some, discernment on the situation and really come up with what would be the ideal action for who we are right now. Again, no point in judging what you did in the past. It was who you were then, but we can always make a different decision when we are faced with something again in the future.
Yeah, and that makes sense. I think I can understand it a little better now than maybe like 5 years ago, but thank you for sharing that. Now, there will be some of our listeners who haven't had the privilege of meeting you yet. And I was wondering, what would you like them to know about your story and how it's gotten you to what you're doing today?
Yeah, so, hi to those of you I never met before. I actually started my training. I graduated from the University of Wisconsin School of Medicine and Public Health back in 2009, moved out here to Sacramento, California, and started my residency training in general surgery. I didn't know that that was the path that I was going to take, but over medical school training, I kind of found myself wanting to be in a type of practice where I got very definite results, right? And like when you have a surgery, it's someone comes in with a hernia, you do a surgery and they should, if you did it right, leave without a hernia and you'll get that result right away. Whereas like it's oftentimes in internal medicine or psychiatry and other practices, like you're playing around with the meds and the patients aren't necessarily following your lifestyle instructions, or you don't have time to give lifestyle instructions because you only had 10 minutes and they're out the door before you can even find out what their grandchildren's names are. And so I just found that type of medicine, if it's had to be practiced like so sporadically and intermittently in the way that the system has basically prescribed and dictated to us, it just wasn't satisfying for me. Like I could not practice that way. So after going through my different rotations during medical school, the only thing I found like to be somewhat rewarding was surgery. And I was very fortunate to be in a position where I score very highly on standardized tests. I had really good grades, and pretty much any residency was open for me to choose. So I ended up out here doing surgery and really just struggling to fit in with the culture. And so, as I was saying, it's really easy for doctors to put themselves aside and to give up parts of themselves that are important, give up things outside of medicine that are important to them, friends, family, interests, hobbies, all those things that make you who you are get pushed aside. And they say, oh, well, it's okay. It's just for residency, right? Like I just need to get through these 3, 4, 5, 6, 7, 8, 9 years if you're like a neurosurgeon. and
Yeah,
then
right.
and then I can go back to being me again. And what you don't understand is that there will never be that future time. Um, you will be constantly put in the position to say no to yourself and say yes to somebody else over and over again, even when you graduate. And I started to witness that a lot. Like I would see my attendings and they would be off on the weekend, right? Like one person had to cover shift for the weekend and the other 4 or 5, let's say in surgical oncology, like they should be off enjoying their lives. But instead they were calling and texting and coming into the hospital. And I was like, what are
Mm,
you doing? You're off, And then when I would have that experience, like, well, I'm off, like today's my day off, or I'm not on call, so I'm going to turn my pager off and I'm going to leave the hospital. People would be like, "What are you doing? Like, you're
mm,
not serious. You're not dedicated enough to being, a surgeon. Like, surgeons need to be here like all the time, 24/7. Your mind is constantly on surgery, and that just wasn't me, right? Like, I've always loved my life. Education was a big part of it, but I kept it again, like I said, I'm very fortunate. I have a great memory and I don't have to spend 30 hours a day studying. So I was able to kind of keep it in a box where maybe other people it consumed their life more. So it was easier for them. But I wasn't ready to give up that part of myself, no matter how much they hated me for it. And my life just became like one struggle after another. And my health really started to decline. I had issues with my blood sugar. Endocrinology couldn't figure out what was going on. I mean, now if I look back, I'm like, well, obviously I was eating terribly. I was drinking like 6 Rockstar energy drinks a day and like not sleeping. So like no wonder my blood sugar was a mess and like I was having diarrhea and it was horrible.
yeah, right.
And then during my 4th year, I was diagnosed with bilateral retinal detachment
Mm,
and had to have surgery, and the recovery was difficult. And I couldn't trust my vision anymore, right? And that included like my vision for the rest of my life. I just said, this doesn't seem like what I want to do with my life. And while I was recovering, I started doing yoga as like an exercise practice because it was kind of the only thing I could do was exercise. I couldn't drive, I couldn't do anything. So I just like walk to the yoga studio or walk to the gym. And that really started giving me more perspective on life. And I started having more interactions with friends and family who were supporting me through all of this. And I was like, this is great. Like I can't go back to this place where they don't want me. Like it's really obvious they don't want me there. They're making my life miserable. Like I was living through hell every day, getting sexually harassed, physically harassed, like just constantly. And it seemed like no matter what I did, I wasn't good enough. And I was like, that's fine. Like I can be not good enough for you. And I have to still be good enough for me. And I have to figure out what that looks like. So I talked to the program and the decision was made that I would voluntarily resign. Looking back, it was definitely more of a force out than voluntary, but I just wanted out, right? And I think at that time, and like people can relate to this, and other residents I've talked to have had this happen to them. Like they're like, no, I just wanted to get away. I would sign anything. I just wanted to be out of this without any negative repercussions for myself. And what they don't realize is that, there's still lots of negative repercussions when you just let the system have what it wants with you. So, looking back, that was maybe not the best decision, but it was a decision I made at the time with the information that I had. And I moved forward. I went into urgent care for several years. And then in 2016, I started practicing telemedicine, and really just seeing how doctors could be really taken advantage of in that system. I mean, they're trying to give you the lowest possible payment for the most amount of work they can get out of you. And it just kept getting worse and worse every year. And realizing that these companies are built entirely off of our work and our expertise. Like no CEO in the world would be able to run a telehealth company by themselves because I would say less than 1% of them are doctors,
Right.
And so they're looking at these CEOs who have absolutely no medical experience, no medical knowledge, no way to prescribe or give care to patients, but they're relying on us for this. And yet they're taking the majority of the money that's coming in and leaving the doctors with as little as they can possibly get away with, and saying that, oh, well, doctors are basically Uber drivers, so I just want to pay them for the visits that they do and keep all the rest. And I just was like, that's not okay. So around 2021, like mid-pandemic, we had the idea to start, first what was ViTel Health, which is a technology company. It's a corporation, and help doctors, like support them with technology that they need. My idea has always been to help doctors launch their own telehealth practices and, make it simple, make it affordable, make it sustainable. And I would just talk to doctors every week and every week and every week. And we also added remote monitoring and health coaching to that platform to help doctors, especially primary care doctors, who don't have the time to manage patient lifestyle factors, or maybe don't feel like they have the experience or the expertise needed in that, so that their patients get longitudinal health coaching that is recurrent every month. They get at least 2 visits with the health coaches and really making an impact on their lifestyle and their health. So we added that component. And we started to kind of evolve away from the independent practices more because what the doctors really needed was mentorship, education, and help with things that really only a medical group can provide for them, like malpractice insurance and other things that were costing them a lot of money and increasing the risk to individual practices. So those services then evolved into a medical group, which is the ViTel Health Physician Services Cooperative. And that allows me the opportunity to have created a structure that I feel like is not mine, right? Like all the doctors in it are completely independent. We are independent together, but just like agricultural cooperatives were able to take advantage of shared purchasing and shared goods and services, we can do the same as physicians and create this stronger network of referral partners and primary care doctors, all providing care all over the country, and sharing in all of the resources that we need. So that was the next evolution, and that's where we are today with 2 corporations, a medical group, and a private corporation for technology.
Wow, that's really incredible. So you must be really proud of what you've built. And
Yeah, very
so,
much so.
yeah, do you have doctors like all over the country, or what does it look like today?
Yeah, so we launched in March, like kind of mid-March. We have over 20 members now, and yeah, they're located all over the country. Most of them have multiple medical licenses, multiple state licenses. So they're really looking to launch very comprehensive direct to patient telehealth practices. What we've often talked about as telehealth 2.0, where the doctors are owning the product from start to finish. They have the expertise. They, can get the technology much cheaper. I mean, like I said, since COVID, there's every EMR is got a telehealth component to it, and many doctors don't even need that much technology in order to launch a practice. So we're at this point where there's a plethora of opportunities for doctors. Patients are just craving that relationship with a doctor. They're sick of going to teledoc and seeing whoever's on call with no relationship to that person and telling their same story to 5 different people, because they can't get in to see a primary care doctor at the local health system because every doctor has a minimum panel of 2,500 patients. It's like, well, how is that doctor expected to care for 2,500 patients? There aren't that many 15-minute slots in a month.
Right.
So if somebody suddenly gets sick, they're waiting weeks, they're seeing somebody else who's not their doctor, and they're not getting that continuity of care experience that they're expecting. So we're able to go out and say, like, we're doctors, like real doctors who just want to help real people. And this is how you reach us. This is the types of payments that we accept. And really just being a part of that revolution of patient care.
Hmm. And now, what would you say to people who would say, well, you can't take their blood pressure, you can't listen to their, heart and lungs, you can't touch them, put your hands on them. What do you say to that?
Yeah, and like that's something that I've had since 2016, right? And we didn't even have that much technology in 2016. Now, there's a lot more connectedness. So, doing the remote monitoring and chronic care management platform, like we are fully integrated with devices for blood pressure, fully integrated with glucometers and all of those things that we would need to see the numbers from in real time. So I think even your doctor's office doesn't have real-time measurements of your blood pressure, right? Like they're having you bring in the log and the doctor tries to skim it in 2 seconds so that they can make some kind of determination. But now we're seeing these numbers in real time, and we have people monitoring them and making lifestyle adjustments from those numbers. And then as far as heart and lungs, I mean, there's amazing equipment out there if that's something that's really necessary for the type of practice that you have. If you have patients with chronic heart and lung issues who need to be monitored and listened to, most doctors are finding that a hybrid practice is perfectly acceptable. So for the most part, there was this book, I forget, came out in like the 80s or something like that. And I found it online and it was called like The Care of the Patient.
Hmm.
And in it, the author asserts that 85% of diagnostic capability comes from a good patient history.
Mm-hmm.
And if you think about any doctor's appointment you've ever been to, like they've probably spent 2 minutes on your history, 5 minutes doing some kind of an exam, which you thought was relevant, but may or may not have been. Like as a doctor myself, I can
Mm-hmm.
definitely
Right.
say that some of my exams are just so that you feel better because I already
Mm-hmm.
know what's wrong with you.
Mm-hmm.
And then the doctor prescribes what's wrong with you and you move forward. So I think that there is this perception that most of the diagnostic capability of doctors actually is hands-on when it's really just a lot of listening, a lot of taking in and processing information, which can be done super easily via a Zoom call, if not better, right? Because now I don't have to do an exam on you. I'm going to see what I see. I'm looking at Kim right now. I can see that she's breathing. She's not wheezing. Her face is, well colored. She's not pale. She looks happy. Like all of these things are really important to me in making a diagnosis. And most of them I can really easily see, including like your range of motion. So if you stood up right
Mhm.
now, I could
Right.
see your movements and I can ask you, like, if you're like, oh, my ankle hurts when I push on it, right? Okay, well, show
Mhm.
me your ankle and show me where it hurts when you push on it, because
Mhm.
I'm not just going to torture you by pushing and be like, does it hurt here?
Mhm.
And so I think so much of that stuff can be accomplished via telehealth, that it's really the things that need hands-on treatment, right? Those are the things that we do still need to have in-person care for. So there'll be things like broken bones and lacerations or certain things in the eye. Like if you have something stuck in your eye, obviously I'm not going to be able to get it out via
Mhm.
telehealth. But there are so many things that don't fall into those categories. I would say probably over 90% of what doctors see every day on a day-to-day basis doesn't require any kind of hands-on intervention or, touching in any way. And then the things that do, we're looking at these types of hybrid models, like can we share space with each other? Can we
Mhm.
make that aspect of it more affordable as well, because if I'm seeing patients 3 days a week virtually, and I only need 2 days a week in a clinic, and I have another partner who maybe wants to do 3 days in a
Mhm.
clinic and 2 days
Sure.
virtually, like, why don't we share the cost of the space
Mhm.
instead of just one doctor who has to be there 5 days a week just because they're paying rent?
Right,
So
right.
a lot of this, it's interesting, I take from salons, like, right, like
Mhm.
hair care experts, I guess you would
Yeah,
call them,
right, right,
stylists,
right, right.
right? Like,
Yeah.
they don't usually own the salon, they own a chair within the salon, and that's more than enough space, so each doctor could own one room within there. You
Mhm.
can't usually have patients in 2 rooms because you can only be in one.
Mhm.
And then, they actually share liability insurance. Everybody pays for their portion of the liability insurance within a salon, share scheduling, share all kinds of costs like shampoo, conditioner, all of those things you
Mhm.
see in the salon, like that's purchased by everyone. And then they might have their few things that just belong to them that's on their
Mhm.
table. But so much of what they are able to do to keep the costs of providing their service lower is to share those resources among all of the users of the space. So there's a lot that doctors can learn from other specialties.
Right, yeah, that's a great analogy. And now when you were talking about the real life monitoring, is that via, do they wear like a special watch or something?
No, usually, like, at least for our remote monitoring at ViTel Health, we work with a lot of Medicare patients. So what they receive is actually a little cellular hub that goes into their home. So there's nothing for them to download, no apps that they need. And then it comes with the equipment that the doctor's recommending for them. So a blood pressure cuff, a glucometer, pulse oximeter, and a scale are kind of the most common things that doctors want for their patients. And then the patient just uses it as if it were any other piece of monitoring equipment in their home. So most patients are used to taking their blood pressure, once a week or however often the doctor prescribed them to take it. They take their blood pressure just like they normally would, put on the cuff, push the button, and then that info is actually automatically transmitted to their hub, which is automatically transmitted to their doctor's office. So there's nothing special for them to do from that standpoint. And we found that that's actually easiest for patients to use. Now, for other patients who maybe are just healthier or want kind of more general lifestyle integrations, that is definitely possible. And I know, there are apps out there, and I work with a company called Rebel Health Alliance, where that's something that we want to be able to do is to get people's, continuous glucose monitoring information and their Apple Watch information or their Oura Ring or their Whoop, and get all that information in front of the doctor. And those integrations exist, right? So it's really just grabbing them and moving them, into the right portal where the doctor can view it. So the technology is there. It's just getting it all into one place. Because right now we see that physicians are working in multiple technology windows, right? Like they have their
Mhm.
prescribing window, and then they have their data windows, and then they have their documentation windows, and like everything's kind of working in these separate hubs. So eventually what we'd like to see is a more integrated experience so that on the patient side, the patient sees everything they need to see that's important to them, and the doctor sees everything they need to see that's important to them, and things can be very easily transmitted from one office to another.
Hmm. That's great. And yeah, and I've heard over and over again, and of course, I'm a physical therapist, about how you learn so much from the patient history. And if you listen long enough, right, the patient will tell you what's wrong, right? So I've heard
Yeah.
that. So I guess to call a spade, is there any skepticism from physicians like that you want to debunk, like misunderstandings about what you do, or this model of practice that you've come up against, that you've been able to alleviate their
Um,
skepticism?
Yeah, I think it's interesting because they think it's all or nothing. I think for a lot of people, whereas when I was treating patients, let's say for injuries in the workplace, like we worked with a lot of physical therapists, right? So my patients were getting hands-on care,
Mhm.
and they were getting hands-on diagnostics even, but it wasn't my hands, it was my
Mhm.
partner. And
Mhm.
my partners were these physical therapists, and they would send me really detailed notes and like the range of motion, like way better than anything I'm going to do as a doctor in
Mhm.
a doctor's office. Unless you're an orthopedic or a sports medicine specialist, which most people working in urgent cares are not, um,
Mhm.
you're not going to do as good an exam as a physical therapist is. And so I would be like, well, I'd rather have their exam than my exam any day. So I think looking at it as telehealth is a tool, like it should
Mhm.
be utilized, you know, to the benefit of both the physician and the patient, right? So the physician is the one who's going to know, like, when do I use this tool versus when do I not use this tool? So patients can definitely be triaged. I hear this all the time. People give, Dr. Brian Fine a hard time. I don't know if you know him, but he does text messaging with his patients, and he has no problem telling them, like, this is kind of above the level of me being able to deal with this. Like, you're going to have to go somewhere in person. And, most people are near an urgent care. Most people are able to get some kind of in-person care when that's appropriate, but it should be up to the doctor, not up to the health system, right? If I can complete and answer a message in a chart versus have a phone call versus do a video encounter versus I need to see you in person, like, I should be able to make that decision. Whereas most people work in health systems, the health system will say, no, you have to see them in person, which again adds to the bloat on their schedule. Like, oh, can I sneak this person in to a 15-minute appointment? I don't know. Like, I might need more time to talk to them, but I don't have more time to talk to them. So when you're able to interact with the patient, get the information you need, direct primary care doctors are doing this perfectly, right? Like, they say, like, everything's included, texting, emailing, phone calls, like, then see you in person when I need to. And they are the ones deciding with the patient's input, like, are you comfortable with this plan of care? Like, I'm comfortable saying, like, yeah, this is probably a UTI. You get them all the time. Let's try treating it with what we normally treat it with. And if it doesn't get better, then we scale up to, you need to come pee in the cup and be seen in person. So I just love that the doctors are taking control of the care delivery and the environment of the care delivery in this situation, whereas in other situations, we're just really dictated to us what is the environment for care delivery.
Right. No, I definitely understand what you're saying, and it makes me think of way back in the day in the early 90s. I was working in an outpatient facility and I was doing part-time outpatient, part-time pediatrics. And if we had an orthopedic patient, physical therapists could evaluate but not treat without a doctor referral. So they had to go to the doctor, but then the doctor would just write neck pain, a valid treat. And we would just laugh because we would figure it out. It's exactly what you're saying, right? So it was as far as time and money, to make the doctor go to, the patient go to the doctor for him to say, neck pain, a valid treat, and then we would figure it out. But then also we obviously wanted what was best for the patient. So if we couldn't figure it out, or if we didn't know, or if they didn't get better in a reasonable time, we would send them to the doctor, saying we think you need an x-ray, or we're not sure what's going on. So when you can really work together as a team, that's really an ideal situation.
Yeah. And I think that's where the idea of working together in a cooperative is really important, because doctors are raised, for lack of a better word, like, we're grown up, we're brought up through this system where we become super competitive with each other and with other professions, and just really take that to, like, the nth degree of, like, we competed with each other in college to get into medical school. We competed through medical school to get into the best residencies. And then we go out into practice and it's still a competition. It's like, no, who can see more patients and make more money and do the things, but it doesn't, at some point you have to realize, like, there's more patients than one person can take care of, right? Like, even when I work in digital health and I work with other companies that are similar to my company all the time. And I was like, well, let's just look at California. Like, there's literally millions of Medicare beneficiaries. Like, I can't take care of millions of patients on my own. And that's just one state.
A scarcity
Like,
mindset, right?
what am I going to do? So you have to understand that, like, there is so much abundance in care that can be delivered. We all have different areas of expertise and even different areas of interest. And that goes back to understanding yourself and understanding your authenticity and how do you want to practice? Because maybe, Kim and I aren't connecting because I'm not the right doctor for you. And maybe another doctor would be able to see what's going on with you better, or come to a different treatment plan, which would be equally as good, right? If you ask 5 surgeons how to repair a hernia, you'll get 5 different answers. No one is wrong. They all work to repair the hernia. And we see that a lot even in primary care. There's many different ways to arrive at a better outcome for patients, but it has to work for the patient, and it has to work for you. Like, you have to feel like you're being true to yourself. So if I want to focus on lifestyle modification, but the patient is like, I wanted all the drugs. Well,
Mhm.
they're probably not the right patient for me, right? And
Right.
so I'm going to have to find somebody who can provide that balance for them. And that's okay. It doesn't make me a bad doctor or you a bad patient,
Right.
right? Like
Yeah,
we
yeah.
just have different needs and we have to find the person that works for us. So having a wider network of people
Mhm.
who are all trying to achieve the same goal, there's a better opportunity for the patient to find the right fit.
Yeah, no, thank you. That makes a lot of sense. As we're winding down our conversations, was there anything else you wanted to share or any top tips you have for your colleagues from seasoned physicians to medical students or even those considering med school?
Yeah, of course. I think, we have to look at where the future of medicine is going, not just, what's popular right now. I think what we're seeing in the way that people, like I said, want to be treated, there is more of a desire for relationship. I think medical students and those going into medical school shouldn't discount primary care. I think that it's been discounted now for so long because the payments have been horrific and the hours are bad, and it's not seen as conducive to a balanced lifestyle or fulfilling or happy or any of those things. And like I'm saying that as somebody who came out in 2009 from my training and was like, no way, I could never do primary care.
Mhm.
That sounds horrible. But now I'm actually, practicing some level of primary care in real time with patients. And we call this, for lack of a better word, medicine 3.0 even. It's like
Mhm.
that tailoring of care, that personalization, that admission that I don't know everything, but I can keep learning, like that's
Mhm.
really fun. And it's something that not every specialty gets to always participate in. So if you're thinking about medicine and you love learning, you love developing relationships with people, which I think most doctors probably do,
Mhm.
then yeah, primary care that is under your control of how it's delivered is awesome. So I'd love to keep seeing like people going into this direct primary care models, these membership-based models, where they get to decide how care is delivered, at what level, what kind of technology is integrated, all of those things. And patients are just they're here for it. They're like,
Mhm.
please, like get more primary care doctors who want to interact with us like real humans.
Yeah, well, thank you so much for sharing that because when we're all talking about, the healthcare system needs to change and what needs to change and what's going to happen, I just keep saying over and over again, invest in primary care, right? And also they deserve better compensation than they're getting, the doctors. And I think primary care physicians and ER physicians are a couple of the coolest because they can either figure everything out or if they can't, they know the next step or who to refer the patient to. So I think it's a very interesting specialty, and that's what we need. And as far as preventative care and all that, so I'm all about, and I love my primary care doctor. He's awesome. And I think that's terrific. And having these other options, people who were maybe going to steer away from primary care, hopefully, as they see these other options, they might reconsider it. So
Yeah.
I think
They
that's
can always come and talk to any of our doctors in our cooperative and learn more about the future of primary care. We need to stop looking at how it's been done in the past. And I think students and residents, like they have amazing ideas, but
hmm
they're seeing their ideas and their interests get squashed. And they
hmm
need to see that there are opportunities out there for them to stay true to themselves, to have these authentic and human practices and to be rewarded for that. And that I see as a real possibility that we're at a tremendous turning point right now in medicine. And we're going to see a large swell towards more, humanistic care.
Right. Well, great. And thank you so much for being a part of the change.
Yeah, of course, like that. And this is coming from somebody who trained in surgery.
Yeah, right. No,
Like,
exactly.
please go into primary care. It's way more
Right.
awesome.
Yeah, yeah. No, I love it. I love it. Do you have any suggestions for patients who wish to support their doctors?
Yeah, I think just understanding that, kind of going back to even what we talked about in the beginning is that we're doctors are and we're humans, like just like you, Kim, like we're navigating our experiences and our challenges in real time. And your doctor is not just like this figure who showed up in the office to only treat patients that day. Like They might have a 2.5-year-old at home who's like being super stubborn and throwing temperature tantrums when they try to leave for work in the morning. And, or they're struggling with a sick parent or a sick relative and that is like consuming them, or they're sick themselves. Like so
Mhm.
often doctors go into work sick and they do their best to show up and be compassionate and to not let those other things follow them into the room. But at the end of the day, like we're all human and we're all trying to show up in very challenging situations as the best version of ourselves. So I think just know that the doctor is giving you as much grace as possible because they know you're sick or hurt
Mhm.
or something.
Mhm.
And you can try to return maybe some of that grace back to them.
Mhm. Yeah, no, I love that. Yeah, to be an example of what you'd like to see in your doctor too. So yeah. Well, thank you very much. How can our listeners find you?
Yeah, best place to find me is LinkedIn. I don't really do a lot of social media outside of that, like always trying to keep those boundaries in
Mhm.
place for myself, and so my son can be present with me and I can be present with him and my partner when I'm not working. So I try to keep it really limited on social, but definitely DM me on LinkedIn. I'm always available there. And on our website at thephysiciancooperative.com. And if you're looking for technology, definitely vitelhealth.com as well.
Okay, well, that's great. So, thank you again for being my guest. This
Of
was
course.
great, and I'm glad we finally had to have a got to have a conversation.
Yeah, me too, Kim. It was really fun.
Yeah, great. And so, in closing, to move the needle in healthcare, we all need to raise our voices and we all need to care about each other. We already know that doctors need to care about patients. Patients need to care about doctors too. So, stand up, doctors, and let's stand up for doctors.